Thanks very much, Bridget. I don't have a presentation slide, so I'll just talk. Firstly, I would like to acknowledge the traditional owners of the land in which we're all meeting today. For me, it's the Wurundjeri and Boonwurrung peoples of the Kulin Nations. And I would like to pay my respects to elders past, present, and emerging, and acknowledge all Aboriginal and Torres Strait Islander peoples who may be present today in this call. So I'm Wee-Ming, and I'm a senior research scientist at NHMRC, where I work on a variety of projects. It can range from peer review policy development to open access of data, doing policy work for the use of, say, MDMA for clinical trials, to development of strategies for antimicrobial resistance. So, and I do also encounter more urgent things, such as funding for COVID research, and also global collaborations for sharing data during pandemics. But for my day job, I manage the clinical trials and cohort studies grants, and also the development grant schemes. And we get about 600 to 800 applications a year for these schemes, with a budget of about $90 million. But so how did I get here? From doing a PhD in conservation and evolutionary biology, studying endangered parrots in New Zealand. I'll have to say a bit of luck, actually. At the time, the Florey was looking for someone to work on large-scale gene expression work in the primitive parts of the brain, particularly from an angle of how sodium affects these parts of the brain. And the lead investigator had an interest in evolution, and we made that connection. And from there, I branched out to investigations in developmental origins of adult disease at the Florey and also at Monash. And that's the time when it dawned on me that the life of an early to mid-career researcher is rewarding, but the relentless juggling, the pressure, the papers, the comms, the budgeting, applications, the grants, networking, and then you try to squeeze in family and friends. And finally, self-care, mental and physical health, sleep. Who needs sleep anyway, right? So I was this EMCR treadmill, but without a real leadership role as such. And at a crossroad, I was asked to join a funded program grant for 5 years. And I remembered clearly the lead asked me, "Do you have that fire in the belly?" I told him, "I don't think I'm the right person to join your group. I can get the job done, yes. But I don't think I can honestly look you in the eye and say, yes, I have the fire in my belly." And that's when the turning point happened for me, just from this person asking me a question like that. And I joined the Heart Foundation as a research coordinator. It was a bit misleading because I was actually to manage the relationship between the organization and the pharmaceutical partners that we had at that time. And there were times when I thought I was in the deep end. I didn't know what I was doing. So first I had to take a hit financially, mentally, my ego. I went from being an expert in something to pretty much a nobody in many things. And I went in with an open mind, learn, make mistakes, work hard, and be excited. But I was fortunate that the team and the director were energetic, agile, innovative, and highly supportive of one another. So the question is, how do you get there? The first is transferable skills, of course. And as Heidi and Brittany talked about earlier, you do have a lot of skills in a variety of areas, but lacking maybe in some others as well, as we're all different. But you'll be surprised how much transferable skills you already have. It is less so what you already have, but how you apply them in a different setting. So to help you along, I think finding mentors and exploring directions is quite important. The good thing about this is that you already have a strong network of people you know. A mentor could be a collaborator, a friend, a colleague. I was fortunate to come across good people, and these were informal mentors that resulted from collaborations, borrowing equipment, committees, or just people whom I knew and merely kept in touch. And mentors will not just help you out, but will also advocate for you. So take the time to develop the relationship and invest in the relationship. And I'm talking about people who will look out for you, who has absolutely nothing to gain from you, but will still give you their time. And of course, this is a two-way street, and you should also value add to your mentor. And one even said, I remember clearly, it was if I was advising my son, I would say such and such. So that's where you know that somebody really cares about where you're going. So the second thing is that relationships matter, and it pays to examine the networks that you already have. What you do currently as an EMCR is not linear. What you do is multifaceted, complex, beautiful, and links in with people. If you have been collaborating with others, you have the networking skills, you just need to give it more time and nurture it. If you have a collaborator with another institution, great. If with industry, hospitals, NGOs, government, even better. Make sure you connect, say hello, and congratulate. So you're out there. And if you see an article where someone you know is featured, or someone gets an award, a grant, a promotion, write them an email to say hi, congratulate them, to connect. Using social media to like something is one thing, but writing someone a personal note makes a very different connection. And when I left research, no one cared that I could analyze large-scale gene expression data, but people cared how I managed the relationship that the organization had with their partners. It was the diversified skill sets that these organizations wanted, including policy development, clinical knowledge, public health, public speaking, influence skills, organizational behavior, maybe even playing the drums. And the next part that is often missed is managing people and money. And different organizations will notice these things, and this is an area that as a researcher, I had less exposure to. So I had to take an interest in managing staff, assistants. I had to manage up to my manager, to executives, take an interest in your budget, how you spend it, how you stretch it, and also how you report it. So manage up and manage down, and it's about bringing people with you generally to manage risk and adopting the no surprises concept. And this is particularly important if you're looking at going into government, where no surprises is extremely important. It is also always good to solve problems beyond the scope of what you normally do. And the way that I got into moving from research to an NGO and to government is actually working beyond the scope of what I normally do, and saying yes to and helping others. So I'm focusing a lot on building relationships, and now is the time to actually share your story. As a researcher, you do have communication skills, and now it's to build on them and give it an angle that appeals to a broader audience. It's about your circle of influence and how you could value add to the new organization. And sharing your story helps because it shows that you're interested, you have a lot to give, but don't push too hard. Knowing when to push and when to wait. And sometimes it's a case of not yet rather than not ever. And timing is everything. I learned that working in the Aboriginal and Torres Strait Islander health space, where conversations need to happen in the right space, the right context, and with the right people. It always comes together when the time is right. But being a scientist, we have the skills to critically analyze situations. So use that to analyze how you could share your story without being pushy. And another part of communications is writing, and the first impression you make is your CV. Now, how many of you have seen CVs with poor grammar, spelling mistakes, and apostrophes pretty much all over the CV? Just have a think about that one. So when you're looking at your transferable skills, ask so what and who benefits out of this? And these are important questions that I learned too late. It is an area that for me was something that I had to consciously push. And I've been guilty of not learning the audience and not reading the room properly. When I was in research, I often speak to people in my field or in related fields. Once out of that, I've had to make a conscious effort to always think, what does the audience want? Working in a large NGO or government, I've had to constantly ask, what does the industry want? Why would they want to play in this space? Will their interactions with the NGO affect their reputation, marketing, sales? As for government, I constantly ask myself and my team, if you were an applicant to NHMRC, which panel would you want your applications to go to? Or what's the best case scenario for an applicant when putting in an application? Or how would this policy change affect researchers? And look into the benefits and also the negatives that come out of that. And one example is the provision of feedback to applicants in the clinical trials and cohort studies grants that I manage. Previously, we did not provide feedback to applicants, but we will be this year. So the main question we're asking here is, how much more burden would it be for assessors? And what are the benefits for applicants if they actually got feedback? And we've always had to balance that. So asking the so what and asking the who benefits are important as they help to balance the positives and the negatives. In working in government, I've also had the privilege to learn from unexpected places. And this is quite an interesting one. In research, we learn from our fields, and learning from unexpected places become less of a focus. And I've been fortunate enough to have worked in multiple projects in the Aboriginal and Torres Strait Islander health space. And they formed some of the most challenging and rewarding projects I've done. Along the way, I have made friends with some of the most dynamic and passionate people. For me, the Aboriginal and Torres Strait Islander ways of knowing, being, and doing are powerful elements that go beyond achieving goals. It's not just about achieving goals. It's about giving things time, having conversations, about listening, caring, and respect. And I learned more talking to an auntie over lunch or an uncle who was a pearl diver I could have ever learned in a classroom or a book. Or a professor whom I work with and I respect, who has helped me professionally, but also personally, as she is an ultra runner. So I'm actually learning in many different environments beyond what I normally do at work as well. So before you jump, if you jump, look for organizations where the culture is healthy and has balance. Look for places where collaborations happen more so than competition. Sometimes it is the team that you need to look at. Look for somewhere with diversity and values that you share. Some of these things are not easy to find out from the outside before you actually enter an organization. So having honest conversations with people you know is important. So just a little recap. A few things to remember. Be ready to take a hit if you need be. You need to leave your ego at the door. Assess your strengths and weaknesses. Get mentors and advice if you can. Give your time to relationships. That's one of the key things. Diversify your skills, including soft skills. Public speaking is important. Maybe playing the banjo is important. Be interested in people, management, and also money. You need to share your story. Share it broadly, even if it's not exactly a place that you are aspiring to move into, and people will know you. Read the room when you're communicating. Learn from unexpected places, and investigate the organization and people before you jump. So I hope this helps provide you with a little bit of advice as to how I moved out of research and some of my experiences after having moved out of research. And I focus a lot more on communications and relationship building in this respect.